Again, many of you may know this, but I think it's important to reiterate why we have vaccinations, why they're important. So starting off with vaccines, so they're a way that we can protect our bodies from any harmful infections. The way that vaccines work, which I'll come on to on the next slide, is helping our immune system to develop very rapid and quick responses to fend off and fight infection, be they viral or bacterial, before we come into contact with them. So really, really important public health intervention. So how do vaccinations work? So typically when we get an infection, as I mentioned, either with a virus or a bacteria or any other infectious substance, we have substances in our bodies called antibodies that fight the infection. What vaccinations do, or vaccines do, is they contain very small, weakened amounts of infectious substances. When they're introduced to our bodies then mount an immune response with antibodies without us actually having to become unwell with that particular infection. So why do we need a COVID-19 vaccination? So many of you on this webinar will unfortunately know somebody who has been impacted by COVID-19. And as we know, it's been a pandemic that's been with us for quite some time now, and vaccinations are providing that glimmer of hope on the horizon to help us, first of all, protect against the serious side effects of those infection when you contract the infection. We also want to protect the most vulnerable in our communities who are at risk of severe infection. And we also want to prevent the NHS from being overwhelmed. So most of you will have heard our London Mayor Sadiq Khan announcing a serious incident in London, primarily because of the high levels of infection that we were seeing and the impact on our NHS. So vaccination is a way of us trying to prevent that as well. So how was the COVID-19 vaccine developed? Well, all vaccines go through very stringent trial processes, and you can see a schematic or an indication of what those different processes are. So you can see that there's a preclinical stage where there's some testing not yet in humans, and then there are a whole range of phases through to approval, going through testing of the safety and dosing of the vaccination. Then moving on to larger trials to again test safety, then larger still to test effectiveness and how well the vaccination works before they're then approved for public use. So they go through a whole range of different stages before finally being approved. So what are the different types of COVID-19 vaccines that have been developed to date? So the 3 vaccines that are currently authorised for use in the UK are those 3 listed there. So the first that came on stream was the Pfizer-BioNTech vaccine. Then the Oxford AstraZeneca vaccine was then approved. And then finally, we've had the Moderna coming on stream over the last few weeks being for approval. So basics around vaccination and COVID-19 vaccination. So how will patients be called for the vaccination? So if you are in any of the eligible groups, which I'll come on to shortly, you will be receive an invitation to come forward, and it will include all the information you need about where and when you go for your vaccination. And we're really encouraging people to wait to be contacted until your time for vaccination. So we're asking you not to contact your practices. Don't worry, we haven't forgotten about you if you are in an eligible group. When it's your time to get the vaccination, you will definitely be contacted. So again, reiterating, we're asking you not to contact the NHS for an appointment at the moment. You will be contacted when it's your time. So where can you get the vaccine? So at the moment, the vaccine is being delivered via the sites I've listed here. So at hospital sites delivered by NHS trusts, in general practice, hence us having quite a number of GPs on the webinar this evening, delivered by primary care networks. We have some community pharmacies coming on stream shortly. And then for housebound patients, there'll also be some services which enable us to get to them. So those who can't travel to any of the delivery sites, where appropriate, the vaccination will come to them. So who will be prioritised to get the vaccination? So the first tranche, or the first stream of the vaccination programme, is really to prevent unfortunate deaths from COVID-19. And we know that the risk of death increases exponentially with age. So we're giving priority for vaccination during this first stage, first of all to those who are in elderly care homes, so those residents, but also those who work with them. Other groups that are being prioritised in this first stage of vaccination are those over the age of 80 years and over, health and social care workers, and then we'll move down the age groups, including those who are extremely clinically vulnerable. So how long will it take the vaccines to become effective? So COVID-19 vaccination, what we're aiming, as I mentioned before, will reduce your chance of suffering from COVID-19 disease. We know that full protection starts around a week or two after you've had your second dose. However, in order to make sure that we vaccinate as many people as quickly as possible, as I mentioned, to reduce that risk of unfortunate death from COVID-19, the Department of Health and Social Care now advise that the second doses of both the Oxford AstraZeneca vaccination and Pfizer vaccines can be scheduled up to 12 weeks apart. So that's a strategy to make sure that we're vaccinating as many people as possible. Is there anyone who shouldn't have the vaccine? So we advise that anyone who's currently has a fever type illness or currently has COVID-19 should not get the vaccine. They should wait till they become better and recover from illness before getting the vaccination. Another common question that comes up is, what is the evidence to show that the vaccine is safe for those in our Black, Asian and minority ethnic communities? So we know that the trials have demonstrated effectiveness or efficacy of 95%, and that's been consistent across age, gender and ethnic groups. And of those who received the COVID-19 vaccination as part of the trial for the Pfizer vaccination, you can see the breakdown there. So they're across a range of different ethnicities. Another question that comes up is, do people who've already had COVID-19 need to be vaccinated? And the answer is definitely yes, they should get vaccinated. As I mentioned, not whilst they are unwell with COVID-19, but once they've recovered. If they're in an eligible priority group that I've outlined, they should take up the vaccination when it is offered to them. There's no evidence of any safety concerns for vaccinating people who've had a past history of COVID-19 infection. Another question that comes up is, are there any known or anticipated side effects of vaccination? So we know that from vaccines that we've been giving to date, most side effects are quite common ones and usually very mild and short term. So some of the most common ones are having that heavy feeling in your arm after you've had the injection, feeling potentially tired, the meeting this evening. Also, the prioritisation for 19 community champions, and we're asking champions to be people out and about in our communities who receive accurate information from us around COVID-19 and then pass on to those who they're in contact with. So I'd really encourage you to sign up. And I will then hand over to Dr. Daiken, who I've mentioned is a South London GP who has recently had COVID-19 vaccination and is going to share her experience with us this evening.
Thanks, Catherine. Is the sound coming through okay? Can you, somebody nod?
Perfectly.
Great,
Perfectly.
Thank you very much. So yes, I'm Daiken and I'm a GP, and I'm really happy to be joining my fellow colleagues here to talk about COVID vaccine. You know, we've collaborated on a number of issues over the last few months, but COVID and vaccination has really been the big one that we've all been working on. So, as Catherine has said, you know, there's a list of people who are priority for the vaccine, and health and care workers are do have some priority. In the area where I work, as NHS workers, we all had to have a risk assessment, and in the area where I work, the GP practices were asked, please forward your 2 employees who are the highest risk. Well, that was me in my practice, along with our practice nurse. So we were very grateful to be offered the COVID vaccine because we have risk factors that put us at high risk. The other reason I was really glad to be going is that I know how hard it's been, the impact of the COVID infections on the communities. I personally know friends who have had friends die. One of my best friends has just spent 2 weeks in intensive care and she's been discharged today. It's really, really tough. And so knowing that I was of high risk, I was terrified of catching it. I've been following all the rules. Don't come in my house, hands, face, space. So yes, I went along to our GP-run vaccination centre. And so when I went, it was very well organised. They checked my temperature before I was even allowed in the building. And then the whole process was socially distanced with lots of checking to check that I felt okay and that I hadn't been in contact with anybody with COVID in the last 7 days. And I didn't feel unwell myself. The actual injection itself was so simple. It's just a very fine needle. It's just like having a flu jab. It's the same kind of size needle that's used for baby injections, actually. So there's nothing special about having the vaccination. And then you have to wait 15 minutes afterwards just to check that you don't have any of the rare reactions that Catherine talked about. And because it was a GP-run centre, I knew lots of people, so I just spent my time chatting. But other people were sitting around, relaxing in armchairs and flicking through their phone, basically, because we weren't allowed to put out any reading material, apparently, because of infection prevention and control. But people were just sitting around reading their phone. And after that, an hour later, I took off my plaster. I didn't really need one. And things were fine. Looking at that list of possible side effects that Catherine had put up, I was on the lucky side. I know people who've had their vaccination and did feel a bit fluey. My arm was just...
Thank you very much. Thank you so much, Di, for sharing your experience with us. Really, really much appreciated. Thank you. Great. So we're now at 6:25, so I'm going to move us into our question and answer section. I can see increasing numbers of questions, over 75 questions. So as I mentioned, we have about 20 or 25 minutes to get through these. I can probably say we're not likely to get to all 75, but we're going to do our very best to get through the most pertinent questions that haven't yet been answered by either Di or myself during the presentation. So I'll go through the first few and I'll call on various members of our panel to respond to those. So one of the first questions I've seen that's come through that wasn't addressed in the presentation fully was, how are elderly housebound individuals being catered for RE vaccination? And I will call on Dr. Chris Ferdinand to respond to that question. Thank you.
Hello, thank you, Catherine. Just to introduce myself, I am a GP in Lewisham, but I also, my practice has already delivered 2,500 COVID vaccinations so far since December. And so we are quite experienced in this. The vaccines themselves are new, and what that means is that they are a bit tricky to handle, and that's why we haven't been able to get out to our housebound patients yet. But I'm very pleased to say that the AstraZeneca vaccine, which was approved more recently, just at the beginning of January, that's the one which is able to be moved between people's homes. And actually the information just came out today telling everybody across the country about how we can do that safely. So how we can do that to make sure that the vaccine, when it gets, so that will slow us down a little bit, but the intention is absolutely to get them all done as quickly as possible.
Yes, for answering that question there, thank you. Now I want to put a reminder to use the Q&A box rather than the chat for your questions. So I'm going to come on to another question that I don't think, again, was answered during the presentation. And I'd ask a member of the panel to indicate if you're happy to answer this question. It was, can we select which vaccine we would want to receive, particularly for people in care homes? So I'll just look to panelists to see if anybody is happy to take that question. Should I say Chris again? Thank you very much, Chris. So Dr. Chris Ferdinand will come back on that question. Thank you.
Thank you. So at the moment, there are 2 vaccines available in the UK. There's the Pfizer-BioNTech one and there's the AstraZeneca one. At the moment, the way that we receive our vaccine is sent to us from a central point from NHS England. So we're not asking for the vaccine, we're not requesting it, it is being sent to us, and that's the vaccine that we will then have that week. There's obviously a massive logistical program going on across the country to deliver vaccine to so that patients across the country can get it. And unfortunately, we don't have a say on what vaccine we receive and when. So that's one of the issues why we can't then therefore offer that choice onwards. It's really a case of trying to get our patients in care homes or anywhere else we want to take the vaccine and get them vaccinated as quickly as possible. Fundamentally, it's really important to recognise that whilst there are two vaccines, they are both equally effective and both equally safe. There's no better vaccine out there. They are both pretty much exactly the same in terms of what they do. And so, in the same way as if you go to a restaurant, you wouldn't specify what brand of food you'd have. We would encourage you not to specify what vaccine you should have, because we feel that they're all exactly the same and just as effective.
Thank you very much, Dr. Chris Ferdinand. Thank you. If I could then move on to another question. Again, I'll look to panelists to respond to this one. This is a question that's come through to say, if we say no to the vaccination, is there an opportunity to change our minds to then receive it? And I'll go to Dr. Simon Parton to respond to that one. Thank you.
Thank you, Catherine. A really good question, I think. And I think we're all allowed to change our minds. And I think that whilst we are running through cohorts of patients based on advice and guidance and moving from one cohort to the next, from the most severely vulnerable down through the less vulnerable and so forth, clearly you may be called for vaccine, have some hesitation, after thinking about it and reflecting it, decide that actually you would like to have it. And I would encourage you to follow that through and then contact your practice to inform them that you've changed your mind. And you can be invited to the next available slot. So absolutely, you can change your mind. Absolutely, if you do change your mind.
Obviously, there are a number of barriers to accessing healthcare, and one of them might be a language barrier. And certainly all practices across Lewisham have access to, well, in fact, South East London, translation services, which are easy to schedule. And a three-way conversation can be had on the telephone with your healthcare provider, the person who requires interpretation services, and also the interpreter on the line. So that service is available, it's accessible, and it's aimed at helping people who don't have English as their first language to access services in primary care. And there's a range of languages provided. I don't remember the exact number, but the suite of languages that are required across South East London are catered for on that.
People need to have a negative test before having the vaccination. And I think this is referring to the mention in the presentation that those who have had previous COVID-19 infection, whether they should be invited, whether they should attend for their vaccination. So I don't know if anybody wants to comment on the need for a negative test, negative COVID-19 test before attending. Dr. Chris Ferdinand would like to respond to that one.
The short answer is no. You don't have to have a formal negative test. That's not what's needed. What you will be asked though when you come for your vaccination is if you've had confirmed COVID in the previous 4 weeks. The reason for asking that question is not because it would not be safe for you to have the vaccine, even if somebody answered incorrectly, if they had COVID or if they didn't know they'd had COVID, for example. Giving the vaccine is not unsafe in that scenario. It just means that it might not be quite as effective. And so therefore, for those who might have had COVID in the last 4 weeks, the advice is to just delay the vaccination just those few weeks so that they get the maximum benefit of the vaccine a little bit further down the line.
Moderna vaccine to Lewisham residents. So Moderna being the most recently approved vaccine. Any panelists like to respond to that question at all? Yeah, Simon Parton.
That's Catherine. So I think the answer is that we don't know the answer to that, quite simply. We are following very careful and strict guidance on what we deliver and how we deliver it to make sure it's effective and safe for the population. What we will do is respond rapidly if we are allowed to use it and follow the instructions on how and when. So I'm afraid I can't give you a specific answer about yes, we will. We just have to wait to be told we can. When we're told we can, you can trust that we will activate it and deliver it with our best ability.
Thank you, Dr. Simon Parton, for that. All around slides being circulated, as I mentioned, they will be uploaded. The questions come through around whether this will be repeated. So I'll come on to that at the end around next sessions and possibility to repeat. Unfortunately, we're unable to record the session today, so we will have the slides, as I mentioned, uploaded, and strongly consider repeating the session owing to the great interest that we've seen this evening. So again, I've seen quite a few repeated questions come through about the numbers of people in Lewisham who've had the vaccination. Again, I may comment alongside any of the panellists who'd like to come in on this. I can see Ashley may want to add a comment. Thank you, Ashley.
Yeah, so as you can imagine, vaccines are being given on a daily basis, so the number is changing, but approximately around 6,000 vaccines have been given. I think obviously there is something in terms of the number of vaccines that have been given by our primary care sites, but obviously in tandem to that, we are now having patients vaccinated through the hospitals, through the mass vaccination sites, and as of next week through community pharmacy as well. So obviously that number is moving literally on a minute by minute basis. We are kind of working locally and, as you can imagine, nationally on kind of more precise kind of dashboards, but at the moment, around 6,000, so a significant proportion of our population, particularly our over 80s, which obviously is the group we're focusing on. And I'm pleased to say by the end of this weekend, we would have got out to all of our care homes, obviously focusing on the residents, but also care home staff where vaccine has allowed that. So yeah, very quickly getting through the vaccine and the numbers.
Thank you very much, Ashley. Another question's come through, and again, this might be something that we may not be able to answer, but the schedule expected for other age groups, so age groups below the 80s and over, further down the list of priorities. I don't know if any panelists would like to comment on that schedule. Dr. Chris Ferdinand would like to come in.
Yeah, I know there's a lot of questions of people asking when they might be invited for their vaccine, and obviously it's great because people obviously indicates that people are keen to get their vaccination done. So that's really fantastic. The vaccination programme, it aims to prevent people who catch COVID from becoming seriously unwell. And what we know is that those who are at greatest risk are the elderly, and particularly those who live in care homes. The last slide on Catherine's presentation showed a link to something called the JCVI, which stands for Joint Committee on Vaccines and Immunisations. And if you just Google JCVI priority groups, you'll be able to find the list of what the priority groups are. And it starts with those who live and work in care homes at the top. And then group 2 are those aged over 80, and then it moves down. The ask from the government is that we do the first 4 cohorts in the JCVI groups by the middle of February, or at least have invited everybody by the middle of February. Those 4 cohorts essentially are everybody over the age of 70 and those who are clinically extremely vulnerable, so those who are on the shielding list originally. So those are the groups that we will fully intend to do by the middle of February. After that, we will then continue to move down the groups. There's been a few questions about when people who are under 18 might get back, their children being vaccinated. The groups go down to group 9. Group 9 is those aged over 50. So if you are fit and healthy and under the age of 50, at the moment, there is no plan for you to be vaccinated. Obviously, things may change in the future, but at the moment, the 9 groups only go down to those aged over 50. Importantly, group 6, those are the people who would normally be eligible for a flu vaccine. So that's anybody aged over the age of 16 who has an underlying health condition such as diabetes or heart disease or asthma or COPD. They are the people who would ordinarily get a flu vaccine. And even if they are under the age of 65, they will be vaccinated in group 6. So time frame for that, I mean, it depends on the practices with which you're registered, but certainly we would hope to be into that group of those who would normally get a flu vaccine, that group 6, certainly by April, May sort of time. Hopefully before then.
Thank you very much, Dr. Ferdinand. Another question that's come through is around clarification on how people receive their invitation to get a vaccination. And there's a concern expressed here around some of the text-based scams in operation at the moment. So any comment from any panelists around how people are being invited for vaccine in Lewisham, and any reassurance to give around preventing any scam operators around vaccination at the moment? Any panelists like to come in on that? So Ashley, you'd like to come in?
So I'm happy to start on that. Then Dr. Ferdinand may want to come in, who's obviously been directly involved in the process. So at the moment, we're getting quite short notice on deliveries coming in, particularly to the practice sites. I think people have put in the question and answer box. We know there are issues with the post in Lewisham at the moment. So I think the reality is at the moment, most of the invites are going out either by text, where we do hold mobile phone numbers, but that is also absolutely being backed up by telephone calls as well. So we're not relying on the postal system. And as I said, with the short notice time frame that we have got available, looking at kind of text messages where that works for people, and if not, then supplementing that by phone calls. As I did say, in terms of the different delivery models that are starting to come online, we do know that some patients are now receiving letters that are being sent nationally. So we're not sending those locally, they're coming out nationally, and they will be inviting patients into some of those, as I said, those other, so the mass vaccination sites and the pharmacy sites. So I think at the moment it is a bit of a mixed model. Some patients will be contacted by text, some by phone, by post, and unfortunately some patients may get contacted more than once. And even after they've had the vaccination, they may get contacted again. So can only apologise for that, but hope that kind of provides an explanation around the different models and why patients might get contacted more than once. And obviously, if you've had the vaccination, then you don't need to go and have another one. Obviously, you need to come back for the second dose at the right time. But yeah, please, obviously, where you've had that first vaccination, that they will then recall you for your second vaccination. And yeah, as I said, just an apology, because I know it is going to be quite confusing, and we'll do everything we can locally to clarify the messages around that.
Very much, Ashley, and I can see Dr. Simon Parton wants to come in as well.
Thank you. Just absolutely echo Ashley's comments. Just to reassure the public that the system of texting recall we use is secure, because we know that people feel vulnerable to scams and so forth. And that we don't rely on the one platform, as Ashley said. We also speak directly to communicate with those who don't have a mobile number. So if you don't have a mobile number, you will be contacted by other routes. So just some reassurance to everyone. Thank you.
Thank you, Dr. Simon Parton.
That my dad goes back for and I go back for, and so it's helpful to know the date that you've had the injection, so that the correct spacing is given before one goes back for the second vaccine. So Di, even though you had yours elsewhere, it was the same for my dad today and myself.
Thank you. And Ashley wants to come in.
Yeah, I think the only other thing I'll just add to that is all vaccinations will be sent back to patients' own GP and will be coded in their record. So that will be the other kind of source of recording that vaccination has taken place, which obviously will be clear, when that was done. And as Jackie said, then that can then be used as a mechanism to make sure we're calling patients for the second dose. So as well as that kind of physical card that people will have, it will all be hard coded into the patient's GP record as well.
Thank you very much, Ashley. Thank you. Okay, so if I can move on to a question. We've seen this question come up a few times about those who have hearing impairments or are deaf. Are there any particular ways that they can access information about COVID-19 vaccination, potentially printed materials, etc.? I don't know if anybody on the panel would like to respond to anything that provided to date.
So, Catherine, I'm happy to take that. We have raised this. We have raised this nationally in terms of any resources that might be available, and also we're looking at that locally in terms of how we can use existing material and put that in formats that are accessible to people. So yeah, I think that's a point well made, and an area, as I said, that we have asked for some support from the national team, and also working on locally to make sure we've got some really good accessible information available to people.
And Dr. Simon Parton wants to come in on that question as well.
Just to follow on from that again from Ashley, so I think it does raise the question of accessibility generally to healthcare for patients with hearing and visual impairments and other impairments that might make it tricky. And certainly as practices, we try to capture that information to put it on coding, which can help us help our patients in terms of the movement through the healthcare system. But I would encourage patients who are struggling with access, whether it's to the COVID vaccines or other aspects of their healthcare, because of maybe so it's a hearing impairment or visual impairment or a physical impairment, to let the practice know so that it can be referenced and coded, not to highlight a problem, but more to help us help you. So do think about doing that.
Thank you very much, Dr. Simon Parton. The next question is a follow-up, I think, from Dr. Jacqueline McLeod's experience. Can people be escorted, i.e. can they have a family member accompany them for vaccination if they need assistance with mobility, so on and so forth? I don't know if any panelists want to come in on that.
Obviously there are large numbers of people that need to be catered for with this vaccine programme, and as some members of the public who've been for their immunisations, I could see in the chat, they've been very impressed by the processes that they've gone through the organisation. I think particularly the Jenna came up there. And so, yes, it's expected that many people, particularly over 80, which is one of our first cohorts, will require people to come with them to support them to actually go to get their immunisation. So it's expected, and space is allowed for a relative a carer to come and support that person to have their vaccine and to be with them if they require to wait for the 15 minutes after they've had their vaccine. At least they've got a carer or person with them. Obviously, that does mean that in terms of scheduling and in terms of space that's required, we've had to do quite a bit of logistics to make sure our premises can accommodate not just only the people who are receiving their immunisations, but also their carer or their relative or their loved one at the same time. I think, have I answered the question? Good.
Great. Thank you very much, Jackie. Thank you. If I could then move on to a question that we've had around the delay of the second dose. So I've alluded to that in the presentation, but if any panel members want to come back in on the rationale for that and what's going to be happening with that going forward, I think Dr. Bisberg wants to come in.
Thank you. So what we have to remember is that the vaccines have been trialled, and when those trials were done, they looked at what happened to people's immunity after being given the first dose. And what they saw is that by giving a second dose at 3 or 4 weeks, depending on which vaccine it was, that then gave a boost to the immunity, which then meant that there was longer term protection. However, what we know, particularly with the AstraZeneca vaccine, is that that initial immunity after one dose continues to persist for up to 12 weeks. And therefore, as long as you have the second dose within that 12 weeks, you get that prolonged protection from the second dose of the vaccine as if you'd had it at 4 weeks. So we know that with the AstraZeneca vaccine. The Pfizer vaccine was a little bit different in that they didn't formally test that, but the rationale kind of applied to the AstraZeneca. If we apply that to the Pfizer vaccine as well, the same should hold true because our immune system is predictable in that way. So we can expect the Pfizer vaccine to work in the same way. What Chris Whitty, the Chief Medical Officer, had to do, in making the decision was, given that with this new strain of the coronavirus and the number of cases rising to quite worrying levels, that initial protection provided by the first dose, what was the decision made was to try and give back to as many people as possible, to give as many people as possible that first initial bit of protection. And so this is one of those, we've all gone through a very difficult year, and we've all had to spend time in lockdown and not see our loved ones. But the thing is, we've all done that together because it's for the good of the whole country. It's for not just for our own, it's not for our benefit, it's for the benefit of our neighbours, it's for the benefit of our elderly. And this was just another one of those decisions that was done for the benefit of everybody. If I tell you that across the country, 3 million people have now received their first dose, if the second doses had been done, that number would be half that. It would be 1.5 million or less. So if you think about that extra 1.5 million of our most vulnerable, people aged over 80, people aged over 75, who have now had that first dose and had that bit of protection, you can see why it was a decision made for the benefit of the population, but without necessarily causing any harm to those who've already had their first dose, because as long as they have that second dose within the 12-week period, then they should have that long-term protection as well. So that was the reason for the delayed second dose. So, I mean, effectively, from when you had your first dose, if you have your first dose, if you just count forward 12 weeks back to the date by which you should have your second dose. And so if you haven't heard from your practice by the time that second dose is due, please get in touch with them. And I'm sure they'll make sure that, hopefully they will be in touch with you. I fully intend to be in touch with my patients for their second dose.
Thank you very much, Dr. Ferdinand. Thank you. So I will be drawing the session to a close shortly. I'll just take one further question that I've seen come up a few times, and this is about the effectiveness of the vaccinations around the new strain of coronavirus that we've seen in England. So I don't know if any panelists would like to add a final comment just on the effectiveness against the new strain before I have some closing comments. And we close. Dr. Simon Parton wants to come in there.
Thank you, Catherine. So, yes, I think that there is certainly no evidence published through research at the moment thus far that the current vaccines that we have, that we're using in the UK, so Pfizer and AstraZeneca, don't provide protection against the new strains that we're hearing about in the press. So I would encourage people to continue to vaccinate with our current vaccines that are available, and to let's maximise the uptake across London, across Lewisham, but we have no information to say that there is less effectiveness against those strains that are developing. And if I may take the liberty, Catherine, just to say as well, we have a lot of claps on Thursdays in the past and so forth, and I think I can speak for all the panellists to offer you all a big thank you as our residents in the borough for everything you're doing to keep each other safe, and we'll encourage you to continue to do so. A huge thank you to all of you. Keep your distancing, wash your hands, take care, and take up the vaccine.
Very much. Thank you so much, Dr. Parton, for those words and for that response to that question. So we're now 3 minutes to 7 o'clock. I know we've got some busy GPs who may have some work to do beyond this webinar. So I will be drawing that to a close for this particular evening. I'd just like to extend my thanks to all of the panellists who've given up their time today. So to Dr. Simon Parton, Dr. Daiiken, Dr. Chris Ferdinand, Dr. Jacqueline McLeod, CCG colleagues Ashley O'Shaughnessy, and my public health colleagues Lisa, Daniel and Genesis. Thank you all so much for taking part in this. I'd like to thank you all for your participation in a really informative event. Thank you for your really helpful questions. As I mentioned, we tried to get through as much as we could. With now 202 questions logged, we weren't able to get to all of them, but we will be, as I mentioned, putting these slides up on the dedicated web platform for this webinar. We will seriously consider running another webinar of this nature with definitely an extended attendee count. Again, you exceeded our expectations around that, so we'll make sure that we make that fully accessible for everyone, and definitely take into account mention of those with either sight impairment or hearing impairments, how we can make these sessions accessible for them as well. So thank you all for joining. Again, as Director of Public Health, I do have to remind you of hands face to face before I close, and making sure that you all continue to wash your hands, continue to wear your face coverings in enclosed spaces, continue to keep your distancing of 2 meters, continue doing all that you can to comply with the national restrictions currently in place. And as our colleagues have mentioned, we can all work together to keep Lewisham, London safe. So thank you all for joining this evening, and we'll hopefully see you again soon. Thank you. Take care.